why is the outbreak so especially devastating there? New York City is the densest metro area in the country. That's the most obvious answer, probably the biggest problem. The city also has an awful lot of people traveling to and from other infected countries, and that's significant too. But it's not the whole story. As this deadly virus emerged from eastern China and began to spread inexorably across the globe, clearly headed here, leaders in New York not only failed to shield their citizens from it, they took affirmative and aggressive steps to increase the risk to their population. Why would they do that? Well, because they were worried far more about being called racist than protecting human lives. That's not an overstatement. That's not hyperbole. Watch the city's health commissioner, Cyrus Barbot, urge New Yorkers to spend as much time as possible in crowded public places. Keep in mind, this video is from February 2nd of this year. That was long after the threat from the Chinese coronavirus was obvious to anyone who was paying attention.
The risk to New Yorkers for coronavirus is low, and that our preparedness as a city is very high. There is no reason not to take the subway, not to take the bus, not to go out to your favorite restaurant, and certainly not to miss the parade next Sunday. I'm going to be there.
Take the subway, go to dinner, people cheer. They feel good about themselves. Future generations, though, are going to watch that video with their jaws open in disbelief. How could someone charged with protecting public health so recklessly endanger it? They'll watch this performance from State Senator John Liu, too. Liu suggested that people who might be concerned in any way about contracting a deadly disease, or who might be interested in where it came from, must be, and you guessed it, bigots.
But there's really no need to panic and to avoid activities that we always do as New Yorkers. We are a hardy people. As an Asian American, I've been somewhat disturbed, if not outright appalled, at some of the comments or gestures that I have seen. Diseases originate from anywhere or from particular places in the world.
In other words, as a member of a protected interest group, I'm ordering you to ignore this threat to your family on moral grounds. Go.
Hi, I'm Dr. Roxides Barbot, and I'm New York City's doctor. As Health Commissioner, I want to let you know that we have no confirmed cases of novel coronavirus, what we're now calling COVID-19, in New York City. Community transmission, or the spread of the virus from person to person in other countries around the world, has raised our level of concern. But rest assured, we are employing all the tools at our disposal to keep New Yorkers healthy. If you're wondering what you can do, here's what we recommend for all New Yorkers. Wash your hands frequently. Hand washing for 20 seconds can help stop the spread of respiratory illnesses, including COVID-19. Also, avoid touching your face. And if you've got a cough or sneeze, do it into your sleeve. Do it into your sleeve and not into your hands. If you're feeling sick with a cold or flu-like symptoms and you've traveled to places like China or other places that have ongoing coronavirus activity, stay home, call your doctor. Same thing goes for your kids. We need New Yorkers to stay vigilant against the threat of coronavirus. Stay tuned for more updates. We'll be sure to get right back to you. But remember, New Yorkers, we're in this together.